If you like my videos, please subscribe to my channel. And my channel name is Dr. Javed Iqbal Khokhar, Lectures on. Thank you very much. Hello everyone, I'm Dr. Javed Iqbal Khokhar, Professor of Forensic Medicine and Toxicology. As we are discussing thanatology, and this is the fourth lecture on this topic. And in this lecture, the learning objective will be that we'll be discussing the changes after death. And they are classified as immediate changes, early changes, and late changes. The purpose of studying these changes after death is that they help in estimation time since death, which is the most important objective according to legal point of view also, medical legal point of view. They are the immediate changes which appear at the time of death. They are basically the signs of death at the moment of death. And they are the signs of loss of tripod of life. There are certain skin changes and certain eye changes. So in this lecture, I will be discussing the immediate changes. So changes which appear after death, they are because this organic matter, this body has to convert into inorganics. And a poet said beautifully in our national Urdu language, Zindagi kya hai, anasar mein zahur tartib, maut kya hai, inhi ajza ka pareshan hona. That means life is a beautiful arrangement of the elements, and death is disintegration of those elements. So when we classify these changes, they are classified as immediate changes, early changes, and late changes. The occurrence of somatic death is based upon basically the knowledge of the signs of death, and they are helpful in differentiating between death and suspended animation. And the signs of death, moreover, help us in estimation of time since death, that how long this person is dead. And this may be important in relation to death investigation. Police will not only wish to know about the cause of death, that how the victim has died, but also will like to know since how long he or she is dead. So estimation of time since death is rationally one of the most difficult and probably inaccurate technique in regards to forensic pathology. No single test is dependable, and all the possible evidences must be correlated to try to arrive at some sensible time bracket, and that is known as the bracket of probability within which death could have occurred. That is, when we give the time since death, that doesn't mean that this person is dead since so many hours, so many minutes and seconds, but by studying the changes which have you noticed on the body, because they appear in a definitive chronological order in a time frame, so we estimate those changes and give a bracket of probability that this is the time frame since 6 to 12 hours, 12 to 24 hours. So such is the bracket, and the person might have died in that bracket of probability. So that's how we estimate time since death, by studying the changes which appear after the death. So it gives a range from an earliest to the latest time of occurrence of death. Now, starting with the immediate signs, these are the changes which are noted at the time of death and within a few minutes of death. Mainly they comprise of traditional signs of death. And on these signs, usually that the diagnosis of death is made, and moreover, they also exclude apparent death or suspended animation. So first sign is the primary flaccidity and loss of reflexes. This is because of loss of innervation. And at the time of death, the muscles relax and lose their natural tone, with the result that now they are insensible, the insensibility and loss of involuntary power to move. And this is not a sure sign of death. Jaw drops, chest collapses, limbs become flaccid, and a relaxation of facial muscles make the person look younger. Iris assumes a mid position and sphincters relaxes. The wounds inflicted in this stage will not gape as the antemortem wounds will gape. Now the cessation of circulation with flat ECG. When you do the ECG, no cardiac activity will be seen. No ECG and electrical state isoelectrical line will show no cardiac activity. So these signs A plus B are the sure signs of death. Now the third, cessation of neuronal activity. Flat EEG, that the cortical cells of the cerebral cortex will not be showing any activity and a flat EEG will be seen. Then cessation of respiration or apnea. There are certain skin changes which will be visible, like the elasticity of the skin is lost, skin luster is lost, lips are dark in color due to drying. But in case of hypoxic death, the color of the mouth and lips remain red or will become blue. Then the changes in the color of the skin, as soon as the circulation stops, blood is drained from the capillaries and venues of the skin, and skin goes pale, especially on the non-dependent areas. But this is not a constant feature. As in death, where there is a prolonged agonal period, pallor is not seen. Rather, it becomes bluish black, like in asphyxial deaths. In carbon monoxide poisoning and in deaths due to hypothermia, face is pink as in life. Now, about the eye changes. At the death, the eyeballs stare vacantly. There are bilateral fixed dilated pupils. Pupils do not respond to light. Absence of light reflex is there, but reacts to drugs for 1 hour. Corneal reflex is also absent, and there is haziness or cloudiness of cornea within 10 minutes after death. If the eyes remain open and atmosphere is dry, and the moisture from the surface of the eye will be evaporated and they will become hazy and cloudy. However, this haziness can be removed by placing just a few drops of water. Then a very specific ophthalmoscopy, if it is done of the retinal examination, a phenomena of cattle tracking will be seen. That is, the retinal vessels will become dotted and segmented. It reveals the stasis of the blood, and the fragmentation of the blood columns is known as cattle tracking. And this phenomena can be observed within 10 seconds after death in 85% of the cases. And this is the picture of the, you can see the retinal vessel which is fragmented and dotted. Then Tock's noires. This appears on the sclera within 3 hours if the eyes remain open a brownish black discoloration on the sclera due to deposition of the cellular debris and the dust. And this is how it appears. The optic disc become pale, pupils which were dilated and fixed initially, but after development of rigor mortis, they become constricted but fixed. Pupils may be unequal in narcotic poisoning. Potassium contents of the vitreous humor rises steadily, and this potassium in the vitreous humor is a very important study regarding time estimation. Then the tone of the eyeballs falls, intraocular pressure fall to zero within 2 hours. Normally it is 20 to 22 millimeter of mercury, but it falls to zero within 2 hours. So summary of this lecture is that we try to understand what are the changes which appear after death and why they are necessary to understand. And they are the immediate changes, early changes, and late changes. And then in this lecture, we have talked about the immediate changes. And they are the loss of tripod of life, certain skin changes are seen, and certain eye changes are visible. And the key home message is that the knowledge of these changes after death is necessary because we have to estimate time since death. Thank you very much. Take care and Allah Hafiz.